So it's Sunday, the 28th, week 1, and this is Murillo. It's about 8:30. Yes.
Yeah. So how was your first week, Murillo?
Yeah, first week was good. It was sort of, I'd probably call it more half a week because Monday was a little bit sort of working stuff out, Tuesday as well. But yeah, Wednesday, Thursday, Friday, I've been a tag along actually. So sort of been floating around the general medicine ward with Tim, but also popping into emergency and outpatients with Dan. And it's been good. I've seen a lot of stuff.
And of that stuff, what was your highlight? What really resonated with you?
I guess one that comes to mind was the 50-something-year-old man who came in with chest pain and had an ECG and it showed ST elevation in some anterior leads. So he was basically having an MI. And it was just interesting because we hadn't really seen any of that. So I only saw that on Friday. So, you know, that's something you see all the time in Australia. There's not as many heart attacks going on here or that are coming into hospital that I saw anyway. So, yeah, getting to talk to him, he basically, his chest pain went away, but he had, you know, Q waves and everything afterwards. So they kept him in overnight and then the next day they were discharging him. And he was pretty sort of blasé, I guess, about it all. And I learnt that here at discharge, someone who's had an MI only gets aspirin for 2 weeks and nothing else. So there's no ACE inhibitors. There's nothing else. So he was literally just getting aspirin for 2 weeks. So I had a chat to him and his wife. Because he was feeling so good, he was sort of walking around, and we had a chat outside with his wife. And I said, "Look, you've had a heart attack," and I explained the seriousness of it, and I talked about the clogging of arteries, and he told me about how many cigarettes he smokes. He smokes these like local, extra strong, no filter cigarettes. So we chatted about that, and I talked about all the lifestyle interventions, and it was cool because I'm certain that no one else mentioned any of this stuff to him. So we talked about diet, smoking, alcohol, all those things, and you know, he's smoking essentially 20 cigarettes a day. So we talked about how he can quit. So it was really cool. So I had a good, probably chatted to him for like 45 minutes. And he was really receptive to it all, and that was probably one of the highlights.
Yeah. And what was the most serious part of the week for you?
So that's easy. So when I happened to wander into outpatients where Dan was, someone told me to see a patient, and it was the first one that I saw over there, and it was basically this 35-year-old woman who had this gigantic, probably 10 by 15 centimeter fungating breast lesion. Probably breast cancer, and she'd come in because she'd had a big bleed from it and fainted. So obviously it'd been there for a while. She'd first noticed it a year ago, and then to learn that she actually came in January, and when it was just a lump before it ulcerated, and the doctor had obviously said, you know, surgery is probably the treatment that needs to be done, and she asked her partner whether that's okay, and her husband said no to surgery. So that was 6 months ago, and then in the 6 months that followed, it progressively grew larger and was in the state which I saw it, which was, I've never seen anything like it, extended all the way into the axilla. So it was interesting to see that, and I mean, the prognosis obviously isn't as good as it would have been 6 months ago, but I talked to her about surgery, and I said how good the surgeon is, and you know, not to be worried about surgery, and sort of that made her feel happy. But yeah, it was very full on seeing that.
What have you learnt this week?
What have I learnt this week? I learnt how to put a plaster cast on, which I'd never done before. So that was with Tim. I followed him into surgery, and we fixed the Colles fracture. We reduced it with the surgeon helping out, and then I put the plaster on, and I probably put it on a little bit too tight, and then got a bit nervous about the kid's arm dropping off, but in the end it was okay. It loosened up a bit, so yeah, that was a good skill. I mean, it's an easy skill, but it was something that I hadn't done yet.
And what do you think you need to improve on?
Yeah, well, Dan stole my antibiotics skill that I need to improve on, and which is what I'm working on at the moment, trying to like learn antibiotics. Even though the antibiotics here are different to what we use in Australia, it's still important to learn it overall. I'm having a lot of trouble trying to do that. Actually, it's quite difficult. Yeah, I think I also yeah, that's probably it. Yeah.
Any other thoughts on your first week here? How's it all going?
Yeah, it's been full on. Lots of autonomy. People listen to your opinions, and you start to see flaws in other people's medical opinions. But you have to be careful. I've not been saying anything, but yeah, you see that. I guess that's probably the difference in how it's taught. For example, what investigations are necessary and versus useless. I sort of saw a lot of useless investigations going on. But yeah, it's been really good being able to see it all.
What about outside the hospital?
Yeah, well, Ash's cooking has been out of control. I can't, the food that we're getting here, given the lack of ingredients and cost of ingredients, food that we've been eating has been just ridiculously good. And the plan is to get some cooking bananas and turn them into nachos, basically. So there's some interesting things going on. Outside of here, yeah, just good to see. We've been trying to mingle with everyone as much as we can, and everyone's been pretty friendly.
Really?
Yeah.